Today I'm going to reveal the 13 cases I submitted for the RCA examination. We're going to look at the spread of cases and the combination of audio, video, face-to-face consultations. If you're new to the RCA, a candidate needs to submit 13 cases and meet the mandatory criteria. Failure to comply will affect eligibility of the submission and loss of marks. What are the mandatory criteria? There are 4 mandatory criteria. The first one is to include one case involving a child under 16. The recording needs to reflect that this is a consultation about a child. A minimum of one older adult over 65. One case involving each of, firstly, acute problem needing urgent investigation or referral. For example, an acute admission or a 2-week wait referral. Secondly, maternal and reproductive health, for instance, prenatal, antenatal or postnatal problem, or this could include contraception or sexual health problem, a mental health condition, and a long-term condition, for example, cancer, multimorbidity, or disability. Last but not least, a minimum of 2 cases requiring examination or explanation of examination. The RCGP has also made a recommendation on the case selection. These are not mandatory, but are recommendation on the case selection criteria. The first one is no more than 2 cases where the focus of the consultation lies in any one of the clinical topic areas as listed in the GP curriculum. The second one is a varying spread of clinical cases and levels of challenge in the consultation. Make sure that you check the RCA guidance as some of the criteria may change in the future. Selecting the right cases is crucial because it can make all the difference between a pass and a fail. It is worth noting that 14Fish platform asks for patient's telephone number when uploading a recording. It is important to label the case carefully and write down relevant information in the workbook. Once a case is uploaded, it needs to be verified. This will be done by your educational supervisor. Before submission, I mark my potential RCA cases against a mark sheet and rank all of them. I selected the top 13 cases that fulfill the criteria for submission. My submission consisted of a combination of telephone and face-to-face consultations. There are no requirements to submit a combination of audio, video, and face-to-face. I've talked with trainees who have submitted audio recordings for all 13 cases and passed the RCA. I've not used video consult for the RCA as there are more things that could go wrong with IT issues and internet connection problem. I have prioritized telephone and face-to-face consultations, which are more convenient and easier for patients. My best combination for submission was therefore a mix of 5 telephone and 8 face-to-face consultations. Telephone consultations. There are many advantages consulting over telephone. Examination can be explained or performed remotely over telephone in less time than a face-to-face consultation. If you're struggling with time management, consider consulting over telephone. You might find it easier to complete your consultation within 10 minutes over the phone. The second advantage is you can jot down key points and refer to your crib sheets or computer screen during the consultation without breaking rapport with your patient. My 5 audio recordings included abdominal discomfort. This was my over 65-year-old case, palpitation, back pain, contraception, and nausea and vomiting. This was my reproductive health case. There are cases that are more appropriate to be dealt over telephone than face-to-face consultation. If a case can't be dealt over telephone, then a face-to-face consultation may be more appropriate. This leads us to face-to-face consultations. At my practice, we use askmyGP. This is a software that allows patients to make a request of the clinical problem to a GP. I selected cases suitable for the RCA from the list of requests on askmyGP and booked them for face-to-face appointment. Challenge with face-to-face consultation is consulting with personal protective equipment. The voice recording may be tricky to listen at times when a person speaks through a face mask. It is vital to use a decent camcorder or webcam with integrated audio to capture good video and audio quality. Some of my face-to-face recordings were too heavy to upload on 14Fish. They were more than 2 GB, so I had to compress the files using Handbrake. My 8 face-to-face consultation recordings consisted of carpal tunnel syndrome, this was my long-term condition, hair loss, bronchiolitis, anxiety, psychosis, chest pain, this was my acute admission, ear problem, and eye symptom. As you can see, the combination fulfilled the case selection criteria by keeping a spread of cases with varying levels of challenge. I decided to submit 2 cases of a clinical topic area for mental health and cardiology, anxiety and psychosis for mental health, and chest pain and palpitation for cardiology. I decided to submit 2 cases of a clinical topic area for mental health and cardiology because they were better cases to submit. While I could have increased the variety of my selection by choosing other cases, that would have affected my marks. The recommendation is no more than 2 cases where the focus of the consultation lies in any one of the clinical topic areas as listed in the GP curriculum. I appreciate it may seem daunting when you start recording for RCA, but getting the right 13 cases is doable. You might find in the first month of recording you don't get good cases, but as you progress through recording and get used to the process, you will find that you get better cases with time. I got most of my good cases towards the later stage of recording. In order to increase the odds of getting the right cases for the RCA, I've written down a list of the cases I'm aiming to record. Having a list is very useful because you can track where you are in the recording, which cases that you're aiming to capture, and which cases you have already got. A suggestion is to share this list with the other GPs in your practice and let them know which curriculum area that you're going to focus for each week. Let's say, for example, you're going to focus on cardiovascular area in this week. I recommend that you share the list with your colleague and let them know that if there are any presenting complaint of palpitation, chest pain, heart failure, or hypertension, to send these cases your way. By distributing your list and letting your colleagues know what cases you need for the RCA, then you increase your odds of getting these cases. Let's say now you have your cardiovascular case. What you could do is to focus on the next clinical topic area next week. By using this strategy, you might be able to get better cases and you will perform better if you're seeing 3 or 4 patients with similar problem over the same week. As you can see on this list, we cover cardiovascular, respiratory, gastroenterology, sexual health, men's health, elderly care, child health, mental health, end-of-life care, neurology, metabolic problems, musculoskeletal, kidney/urology, dermatology, and ENT. Your practice nurse may also help you to identify suitable cases for chronic diseases. This RCA case list is an excerpt of the RCA blueprint. If you'd like a copy of the RCA blueprint, click the link down in the description below. If you want more resources to guide you with your RCA, head over to drerwinkwun.com/RCA. Thank you for watching this video. I hope you find it useful. Take care everybody. Bye bye.